First of all, we have to apologize to the family counselors and family psychologists because we actually used the first few chapters of their systems-oriented textbooks and references and articles in presenting the so-called psychosocial typology of illness and the time phases of illness and similar approaches and models that they were using. But we didn't actually tell everyone what it's all about. If you really think about it, if they're interested in the family, how come they have all these models about the illness? We sort of stopped there and we kind of just borrowed that first part, the introductory part of their discipline. Now, to be fair, we will talk about what it's all about. So what it's really all about is this. You have family medicine starting almost at the same time as family counseling and family therapy, and sociologists and social workers who are interested in family systems or family units in communities, and they were trying to develop some form of scientific field. Now, the family medicine people, even some general medicine and general pediatrics people, are proposing that there is a separate subspecialty field or a separate field, just like cardiology, endocrinology, and the like. Of course, the question is, for you to be a separate subspecialty field, as far as general pediatrics or general medicine is concerned, or for you to be a new specialty field, like the general practitioners want to become the specialist field of family medicine, or some countries they still call it general practice, but it's a specialist field, a generalist approach. You should have some form of scientific superstructure framework. And so what is it? Well, the family medicine doctors are saying, well, it's the 1950s and the 1960s, and we're working with the communities. The thing that defines us and the thing that we have that's not present in the modern, so-called modern 1950s, 1960s, 1970s modern medicine is they're hyper-focused on the scientific and technological and the materialistic view of disease and illness and the materialistic view of the patient, that they forgot the most important thing. We, on the other hand, are there in the community. We take care of people. Actually, we take care of them when they were born. We take care of their moms' parents, the grandparents, and we grow old with them. We participate in community activities. So we actually know that stuff happening in the community and stuff happening in the family are very important, and it actually might spell the difference between caring for them well or not so well, right? So it might spell the difference between success and failure as far as taking care of illness or disease is concerned. So the family medicine doctors were looking at all these developments in family counseling, family therapy, and family psychology and social work, and they were saying, well, they've already started it and they've gone that far. Why invent another one? I mean, it looks like they're heading in a decent direction. All we need to do is borrow it and then try to see how it applies to general practice. Like, how would you advance it and shape it so that it becomes useful as far as we, the generalist medicine doctors, are concerned. Of course, the social work people and the therapists and the counselors and the psychologists are interested in something else, but the models might be useful for us. And so that's pretty much what it is. And let's kind of use it, right? And so again, the general goal is a coherent framework. The systems approach was also, it's like a confluence of different things happening all at the same time in the span of about 1 to 2 decades, was also popular during that time. The systems approach, or the different systems oriented approaches, were also popular during that time. So the idea for some family psychologists would be, well, maybe we can use a systems approach to come up with a comprehensive framework or coherent framework to base a good deal of our science and approaches and to base the development of a decent part of our field. Maybe we can work on that. Another way of looking at it is, if you go through pathology or you go through the clinical sciences, you might see stuff even during those times, like this is this particular disease, and when people go through it, they feel this way and they feel that way, and then when they're worse, they feel this way. But that only applies to that particular disease, and there's another disease which is an infectious disease, and this is what people feel, and these are the issues of the family. So they're kind of scattered all over the place, and it would work if you're a super specialist. Like your entire life is dedicated to one particular disease or like one particular phase of the disease, like you're sub specialist of advanced cases of a particular type of cancer. That will work. So all you need to do is just figure out how the emotional and psychosocial impact of that disease, as far as the family is concerned, as far as the individual is concerned, the pertinent public health and community aspects in managing that disease. That's all you're interested in. But the problem is, if you're a generalist provider like general medicine and general pediatrics or family medicine, well, you're dealing with a whole bunch of diseases. So that kind of very, very narrowly focused to inclusive ideas would only pertain to one particular aspect or one particular disease, and it's not going to be helpful for you. Now, you might try to wing it and try to generalize it on your own, but without guidance, you have a tendency of undergeneralizing it or overgeneralizing it, and of course nobody's going to do any studies because there's no comprehensive framework. So that's the idea. Now, where does the systems approach come in? Well, first, let's probably look at the family systems, because that's where it came from. So you have each member of the family, okay, and each member have different personalities and different characteristics, and then they're going through life stages. Like, you start out as a child, and then you grow older, and then you become an adolescent or a teenager, and then a young adult, and then you go into your 40s and 50s, and suddenly you're like in your 60s, and then that's the individual life cycle, or that's the developmental stages of an individual person. And this person is a member of the family, and the family itself, family unit, as far as the social scientists and the psychologists and the counselors are concerned, you can also view the family as going through developmental stages. They call it life cycle or life stages of the family unit. So first you have the new family, when two people get married, they form a couple, and then they have a kid, and then the kid grows. So it's a couple with a growing kid, and then it's a family with teenagers, and then the teenager becomes an adult. So it's like husband and wife in their 30s, 40s, or 50s, and with a teenager, and then suddenly with a young adult, and then their kid goes off to college, gets married, and suddenly they're left at home. Or they might be a family with an adult kid with another family. That's an extended family. Of course, it becomes complicated if you factor in extended family and all sorts of stuff, but that's the family unit developmental stages. And so the idea is, if you want to figure things out, you have to know how the family developmental stages impacts on the individual developmental stages, and how the individual's personalities impact the family as a unit, and so on and so forth. So that's the family unit. Now, what about the illness? One approach is to treat the illness as if it's like that also. So of course it's not a person, but the illness, it starts out not there. You're just prone to it, you have risk factors, and then suddenly it starts inside you, but it doesn't produce symptoms. It's subclinical, but of course it doesn't have any psychosocial impact because you don't know that you have it. You might know that you're at risk and you're kind of worried, and then it starts, then you notice it and you get diagnosed, and then it develops, and then people are trying to treat it, and some get better, some get worse, and then some people die. And so that's kind of the developmental stages of the illness, right? And this illness also has, it doesn't have any personality characteristics because it's not a person, but maybe we can use other ways of describing it. Like, for example, in general, our descriptions should apply to diseases in general, because, we want a generalized, comprehensive framework that can be useful for many. Of course, nobody's thinking that the model will perfectly apply to each and every case, but we want something that would integrate our bits and pieces of ideas and guide future more generalized systems approach studies on diseases in general, right? So, well, some diseases are acute, and some of them are somewhere in the middle, or some of them are gradual, or we can just use 2 classifications, or we can use like 4, depends on how many you want. But that's like acuity or onset. The course can be progressive, or it can be the same, or it can happen, or it can not happen. So that's relapsing. That might be another way to characterize the disease. The outcome is obviously another way. Some diseases you just get better, it's not life-threatening. Some can be fatal and you'll die because of it, or some, well, it makes you die suddenly, and some people don't die suddenly, or you have a shorter lifespan. So that would be the outcome. The other ways, some can incapacitate you, right? And there's different kinds of incapacitation that, like you can't think well, or you get tired easily, or that's physical. And of course, you can come up with all sorts of ways to characterize the illness personality. You can think of it as like, the illness personality or the illness characteristics. So you have the characteristics of the illness, and then it sort of goes through life stages, the developmental phases of the illness. So you have another so-called, not really individual, but it looks like, and the reason why we're doing that, the reason why it's being done that way is because the systems thinkers want to integrate the illness or come up with a way to analyze the illness as it impacts the individual member of the family and the family as a unit. And it would be a lot simpler if you characterize and describe the illness the same way you would describe the family and the individual member. So that's how they did it. So just like the individual family member, the question is, how does the family in this particular life stage with this particular characteristics, of course you also characterize the family. You can be resilient, how they communicate, how they adapt, how they support each other. There's like all sorts of ways of characterizing the family with these particular characteristics. How does the illness in this particular time phase, going through its own stages of development with this particular characteristics, impact on the family who is going through life also in this particular life cycle stage of the family with this particular characteristics of the family. So that's pretty much how it works. You can actually do it 3 ways, which makes it complicated, but you can do, like, you have this patient who is in this particular life stage with this particular personality and characteristics, biological and psychological or emotional characteristics, experiencing this illness in this particular phase of illness with these particular characteristics. And this patient is also a part of the family. You can do it that way, and a part of the family with this particular life stage and this particular characteristics. Now, the community-oriented medical people, it's so easy to extend it all the way there, and then this particular family is in this particular neighborhood, and this particular community goes through stages also. I'm pretty sure people have thought of things that way, especially during the 1960s and the 1970s, and with this particular characteristics. So it's all a systems-looking oriented approach, and that's the general idea. So that's the reason why we talked about the psychosocial type of illness, using different ways of characterizing the illness. And that's the reason why we talked about the time phase of illness, describing the development of the illness, right? Again, just to emphasize, the time phase of illness had to be factored in. Why? Because we have, in each particular field, they're already trying to figure things out. Like, what's the impact of, you have an advanced stage of cancer. What's the emotional impact on the family or on the person? And then what about the early stage of cancer? But usually nobody follows the illness all the way through. So what's the time course of that particular illness, and as it progresses, what's the psycho-emotional and psychosocial impact on the person and on the family? That's a particular disease. Now, you need a generalized, comprehensive framework so that you can stuff things in your head more efficiently, right? So you can't memorize so many particular stuff. You're a generalist, so you're dealing with not just one particular type of cancer. So knowing all this, how do you look at it from a generalized perspective so that, you see the big picture? So generalist practice is big picture practice. You're dealing with all sorts of stuff, all sorts of people, and all sorts of family units, and all sorts of communities. So that's the general idea. So that's the reason why we had to input the time phase or time course of illness. You're not interested in particular phases. You follow the individual. That's what generalists do. Like, you're their doctor before they got sick. You're still their pediatrician or general medicine person or family doctor while they were getting treated, and you're still their doctor when they're dying or after they got treated. So you're interested in the time course of illness, right? That's pretty much what it is. So what follows, that's just like the first few chapters of those kinds of textbooks or approaches. And then what follows is they start describing the family unit in the same way. They describe the family unit in different ways, communication, adaptation, or whatnot. And then they talk about the family life cycle. And then they start describing the individual in the same way, individual characteristics and whatnot. Nobody has gone beyond that because they're family therapists. They're not like community systems scientists, but we can easily extend it all the way down to community. Same approach, same idea. Of course, it's more complicated. So that's pretty much what it is. Now, after going through all that, I have to point out that the generalized approach is useful in integrating stuff and giving you ideas on the next thing to do, right? But for things to be very effective and applicable to particular situations, then you have to go from general to specific, right? So now, once you become subspecialist, then the general framework that we're teaching right now would be more effective if you look for the specific application of that framework. That's the reason why it's very difficult to come up with specific case test questions based on this very generalized, comprehensive framework kind of model. But this is an introductory lecture and usually part of an introductory course or session. Okay. Now, my final advice to you is to take this seriously, a little bit more seriously than the older generations of doctors, maybe including some of your idolized specialists or consultants or whatnot, because nowadays it's very narrowly focused. Like, they come in and our job is only to think of the test and think of the medication or the kind of surgery to cure them with. There's less and less concern about the family, the social impact, and the psychological impact. Now, the only thing we do is we say it's multidisciplinary or multi-professional, and the reason why we're not doing it is because we don't have funds to hire this and that person. Well, most places don't have funds, and when you don't have funds, you have to do it yourself, right? So not unless you don't think it's that important. And the argument is it is important because you're not taking care of cars, you're not taking care of plumbing, you're taking care of a real person, right? And you're their doctor. Okay, so